Invisible Illnesses, Stoma and Continence series, brought to you by SecuriCare. Whatever your stoma or continence care needs, SecuriCare puts you first.
Hello, and welcome to the first episode of our four-part Invisible Illnesses, Stoma and Incontinence mini-series, brought to you by SecuriCare. In this series, we are looking at the meaning of an invisible illness and exploring the journeys of individuals living with a stoma and or urinary incontinence, as we're joined by several friends from SecuriCare, including specialist nurses who look after people living with a stoma and urinary incontinence, as well as Bob Smith, a gentleman living with a colostomy. To give you a bit of background, SecuriCare is a specialist healthcare provider based locally in High Wycombe, delivering NHS services all over the UK. As well as having a team of specialist stoma care nurses working in hospitals and the community, SecuriCare offers a free home delivery service for prescription stoma and continence care products, as well as prescription medicines through their in-house pharmacy, PharmaCare. Now, invisible illnesses is a term that I'm sure many of us are familiar with, but how many of us have come across the word stoma or urinary incontinence? Well, that's what we're here to talk about today. Around 13,500 people undergo stoma surgery each year in the UK, and did you know that it's estimated that 1 in 500 of us in the country are living with a stoma? Well, whether you are living with a stoma, know someone or have a loved one who has a stoma, or just fancy learning more, keep on listening.
Invisible Illnesses, Stoma and Continence series, brought to you by SecuriCare.
I'm Bob Johnson, and joining me for episode 1 of Invisible Illnesses, Stoma and Incontinence is Zoe Sherritt from the Careline team of SecuriCare, and also Vicky Burrows, who's a stoma care nurse. Zoe, if you can just tell me a little bit about yourself and your role.
Yes, sure. So my name's Zoe Sherritt, and I've worked at SecuriCare for 16 years now. I work on the Clinimed Careline, taking calls from people wanting help and advice with products regarding their stoma or continence.
And Vicky, you are a stoma care nurse. Tell us a little bit about that.
That's right, yes, I'm a stoma care nurse. I've been working for SecuriCare since 2007, and I'm part of a team of nurses here in the community in Buckinghamshire providing stoma care to all our patients in this area.
Okay, Zoe, what is an invisible illness?
So that's an umbrella term for medical conditions that aren't easily visible to others or might not be visible to the naked eye. So some chronic physical conditions such as arthritis, diabetes, allergies, cancer, some mental conditions such as depression, bipolar and anxiety are just a few. Living with an invisible illness can be difficult. Many people are judged and criticised because others think they look fine on the outside but might be making it up, and this is not the case. As with many conditions, the severity of the condition can fluctuate daily or monthly or even annually. Because of the nature of invisible illnesses, there's a lack of social awareness around some of these conditions, and that can lead to a stigma. The best way to overcome the stigma is to educate others about conditions, and that's why we're here today. And a stoma can be perceived as an invisible illness.
So what is a stoma, Vicky?
So a stoma is an opening that's created by a surgeon to divert either the flow of faeces or urine from the body. And it's a Greek word which means opening or mouth. It's where the surgeons create a hole in the tummy wall through the muscles and bring a bit of the intestine out and stitch it in place. And a stoma looks a bit pink, like the colour of your tongue. People often, when they look at it, think it looks angry and sore, but there are no nerve endings there. But what it doesn't have is any muscles in the bowel to control it. So what people are unable to do is manage their own continence. They're unable to control their bowels. So they will need to wear a bag over the top to collect the faeces.
Who is affected?
Anybody can be affected. Anybody from birth right the way through to over 100. My oldest lady was 101 years old, and the youngest I've looked after has been literally hours old.
And why might somebody need a stoma?
So there are many reasons why people can have stomas. They can be either a temporary measure or a permanent feature, and it can be things because of congenital problems at birth or illnesses at birth. It can be from trauma or blockages, or it can be as part of the treatment for something like cancer or diverticular disease.
And what is IBD?
IBD is inflammatory bowel disease, and this is a term that's used to describe two conditions, ulcerative colitis and Crohn's disease. Ulcerative colitis only affects the large intestine or the colon, whereas Crohn's disease can affect any part of the intestinal tract, from the mouth right the way through to the anus. And this is where people get inflammation, swelling, bleeding and pain from the digestive system. And for some people, they need to have a stoma as part of their treatment.
So it sounds like it could affect your daily life quite a lot. How would that affect you, Zoe?
Generally, people have limited knowledge of irritable bowel. There's a perceived stigma of living with IBD. This and the fact that the IBD concerns the bowel and can mean that someone finds it a taboo subject. They don't really want to talk about anything to do with the bowel. People living with IBD before and after stoma surgery have to navigate daily life, and that can be very challenging. Even before they've had their stoma, they're going to work or school, they're suffering from symptoms, and that can be very difficult. They can have pain and tiredness. Also things like managing relationships, knowing when and how to tell somebody, handling social situations. We talk to lots of people who find that very difficult. And of course, body image can always be worrying with people. They feel that people will see them differently. And as well as the physical symptoms, people living with IBD may struggle with their mental and emotional well-being and health. If you're listening and struggling and you don't have to suffer in silence, there are a number of charities such as Crohn's and Colitis who can help, or you can call us SecuriCare and we'll help signpost you to the correct information. Just go onto our website, or our care line number is 0800 585 125. Please feel free to pick up the phone and talk to us, whether you've got a stoma or whether you're suffering from IBD and just need some direction.
The fact that it is a taboo in some areas of society, actually that must then weigh quite heavily on the person who actually has it, because it's just one of those things, as you say, it's difficult to know actually whether you can talk about it, who you can talk about it with.
Yeah, and I think that's the problem. People dashing backwards and forwards to the loo, everyone feels that anything to do with the toilet is your own private information. None of us are encouraged to discuss that. But if it is becoming something that is problematic and is affecting your life, then go and talk to your GP. They deal with these sorts of things all of the time, and then they'll be able to refer you to specialists to help you to manage it. It will improve your life if you can manage it in a different way and get the help that you need. You don't need to suffer in silence. And I think lots of people with invisible illnesses do suffer in silence for a very long time before they talk about it. And that's what we're trying to overcome, because that will start to affect your mental health and your well-being.
Vicky, I think one condition that people are a little bit more familiar with is IBS, irritable bowel syndrome. How does IBD and IBS differ?
So they do have some similar features. IBS is where people are experiencing abdominal pain, tummy pain and some diarrhoea. But what we see in IBD is that people also get inflammation of the bowel and bleedings, and that's not present with people with IBS. But people with IBD can also have IBS symptoms. And it's something that, it can work alongside each other. With IBD, the symptoms can be so severe that some people will require stoma surgery, but this is generally not the case for somebody with IBS.
What should someone do, Zoe, if they think they have IBD?
Right, so there's lots of help and support available. If you think you have either IBD or IBS, you should contact your GP in the first instance. The Crohn's and Colitis UK provides help and support for people with IBD. You can visit their website for more information. You'll also find the number for their helpline there, and you can just give them a call. The IBS network also has really good information. Again, just use Google, have a look, put any IBD or IBS in there, and you'll find lots of help available. And of course, go to the NHS website as well.
What about other causes such as diverticulitis?
So diverticulitis is where we get little pockets or weaknesses that form in the bowel wall. And as we get older, we find that these weaknesses do generally develop in most people. And it's something that many of us have without any symptoms at all. But what can happen is that these pockets can become inflamed or infected. And for some people, that can lead to a perforation, a hole in the bowel, which then can require urgent surgery to fix it.
If you have diverticulitis, is there anything that you can do to ease the pain if you have pain with it?
So again, it's consulting with your GP because everybody's different. But we do generally recommend increasing the amount of fibre in your diet to help speed everything through your digestive tract. It does minimise the chance of you getting inflammation to your diverticulum that you get in your bowel.
Can cancer lead to the formation of a stoma?
It can in some cases, yes. And it's often part of a treatment. So what the surgeons will do will go in and remove the affected section of bowel in cancer, often if somebody's having surgery. And on occasion, they will need to rest the join when they've joined the two ends of bowel back together again, because the blood supply isn't always as rich in the large bowel as it is in the small intestine. But in other cases, it's not necessarily always the case. There are people that go on and have surgery and have the two bits of bowel joined back together again and don't require a stoma. For some people, a stoma can be permanent. So people that have bladder cancer, for example, will have their bladder removed and then will require to have a permanent stoma, just because we can't reconnect everything back together again in the same way.
But that can be the case with some people, that actually you can reconnect the bowel.
Absolutely, yeah. Many stomas are temporary. People will have it as part of a treatment plan, and at a later date will go back and then have the bowel rejoined together again. It just depends really on which bit of bowel is involved and how good the blood supply. But there are people that then choose not to have everything reconnected. It's a personal choice. They may find that their quality of life is so much better with a stoma that actually, why would they want to put themselves back through further surgery and have a long period of recovery again? Especially in older people, we see this. If they're managing really well, they say, look, my quality of life is excellent, I'm just going to carry on as I am.
And I would think that is ultimately the most important driving factor, is the quality of life.
Absolutely.
Yeah, definitely. And people will often say, I don't want to go through the surgery again. Actually, I manage my stoma really well. I just get on with it. Often they'll name them. Yeah. And they just get on with it and live a normal life with it. So, they don't want to go through the trauma of surgery again.
I very much like the idea of naming them as well. I think that's a very good idea. And again, from what we've been saying, though, with regards to, say, the taboo nature, actually, if you come up with a name that everybody knows, say, in your family, that makes it a little bit easier, I would have imagined, to discuss it.
Yeah. Yes, definitely.
People do say, oh, Rue is misbehaving today.
Yeah,
and they understand
Percy.
exactly. Yeah.
What about if you suffer from obstructions or trauma?
So obstructions can occur. Sometimes a blockage can occur in the bowel for various reasons. It can be a mechanical blockage, so it's a twist or something that occurs in the bowel naturally, or a trauma. So it never fails to surprise me as a nurse the things people do to themselves. And I think I've probably seen most things by now. But people do suffer some terrible injuries in quite strange ways, which then can require urgent surgery, which for some people then will require a stoma to be formed.
So why is stoma an invisible illness, Zoe?
Other people are unaware that you have a stoma. That's quite a key thing. Many people choose not to share the fact that they have a stoma. So, and if you're just walking along the road, standing next to somebody in the street, sitting on a bus next to somebody you don't know, it won't be noticeable to a stranger if you've got a stoma. Some people decide to keep their stoma private. That's a very personal decision on who they share it with. Other people will share it very freely with the family, and it's very known and talked about. Having a stoma can be transformative surgery and be positive for many. We speak to many people who say, it's changed my life, I've got my life back, I can carry on as normal. They've spent years planning where toilets are, planning their whole day around where they can go to, speaking to people that have to dash off in supermarkets and abandon their trolley to find a toilet, and all of a sudden they say, I can manage my whole day without worrying about where the nearest toilet is. That's obviously for people for some of the other earlier conditions. It can transform their life, and many people will talk to you about the fact that it's saved their life. If they've had cancer or something, they've got a stoma, they see it as a very positive thing, something that has given them their life.
I find it quite interesting as well that you mentioned that some people have body image issues, and yet we're calling it an invisible illness.
Yeah, and I think that's the thing, isn't it? It totally changes everything. It changes the way that you are going to the bathroom. It changes how your body looks when you're undressed. So it is a real change to them in the way that they are conducting their life. And when they undress, they've got a stoma bag on, so it's completely different. Changes, for some people, they want to think about what clothes they can wear, going on a beach, going swimming, all of those sorts of things, that people all of a sudden have this huge body image change.
And do you find sometimes that people very much say to you that actually they're feel self-conscious when they're going out and are possibly dressing to try and hide the fact that they've got a stoma, whereas actually probably the majority of people wouldn't notice at all.
Absolutely. We get lots of people that will initially ring us and say, where can I get special clothes for stoma? And all of a sudden they realise that they don't have to do that. So there are some fantastic things that you can see online with people wearing their low-cut jeans with their stoma bag, carrying on, on a beach with their stoma bag, because people are now trying to take away that whole taboo of that. And some people will struggle to see that image, but actually, do you know what? That person is alive and living their life and doing what they've always done. And we speak to people that do amazing things, going off rambling for the day and they just adjust the way that they do things, skydiving, swimming, skiing. Most of the people want to go to the gym and keep themselves fit and healthy after the surgery. You can do anything with it, and you can dress normally. You might make slight adjustments to where maybe your waistline is on something, but actually you can live life very normally.
And how common is it? How many people in the country have a stoma?
So it's estimated that 1 in 500 in the UK are living with a stoma at the moment. That's according to the Colostomy UK website. The word stoma is interchangeable with the word ostomy. People living with a stoma are often known as ostomates or ostomists.
Which I think is quite a nice term. How does SecuriCare support people with a stoma?
So we support people living with a stoma or continence problems from the very beginning of their stoma journey.
And we also have the stoma nursing service across the UK and in the local area, which is provided in the hospitals and the communities to help people living with a stoma throughout their stoma journey.
And we offer a home delivery service for your stoma and continence supplies. It's NHS services supply the prescription, which is free, but not to everybody. And then the delivery service that we provide is free. So think about us as an online chemist. We'll deliver all of your special needs directly to your door. And we can also do your medication. So if you're at home living with a stoma or incontinence and you need supplies on a prescription, and you also need medication, we can supply both of those delivered to your door. We'll collect the prescription for you, we'll do everything for you. And if you've got anyone else living in your household that needs regular medication and they are registered at your address, they can also use the service for their medication as well. You've got a friendly voice at the end of the phone when you're placing your order, or you can place your order online. It really is what's right for you, and we'll give you help and advice. So if you're having a problem with anything, we'll try to help you. If not, we'll refer you back to your stoma care nurse, and we've got our experienced care line team, so we have an awful lot of knowledge about products, so we can give you a little bit of understanding about what problem you're having and what other products may help you with that. And people can call our care line from 9 a.m. until 6 p.m. Monday to Friday. Just call us on 0800 585 125 and we'll be happy to have a chat with you and see how we can help and support you.
Zoe and Vicky, thank you so much for joining me today. Whether you are an ostomate, whether you know an ostomate, or whether you just wanted to learn a little bit more about stomas, I hope you found this programme educational and useful. Many thanks to both of you.
Thank you.
Thank you.
Invisible Illnesses, Stoma and Continence series, brought to you by SecuriCare. Whatever your stoma or continence care needs, SecuriCare puts you first.
Thank you so much to Zoe and Vicky from